Hello again. This is our third chapter from Giddens. It's infection, and the reason I feel comfortable giving you 3 chapters is because there's a ton of overlap between the 3 chapters. And this chapter is infection. Define and describe the concept of infection. Infection is the invasion and multiplication of microorganisms in your body tissues which may be unapparent or the result of a local injury caused by competitive metabolism, toxins, intracellular replication, or antigen-antibody response. We're going to talk about sepsis, opportunistic, and epidemiology. Examples of infections in each category. We have viral infections like the flu and cold virus, bacterial infections such as strep, and staph infections. Parasitic or protozoal infections would be like toxoplasmosis and mad cow. Well, actually, mad cow disease, I think they have is something a little different, but and fungal infection would be any kind of mold or yeast kind of falls in within the fungal infection in the same kingdom. Localized infection, the infection obviously just stays locally, it doesn't spread to the rest of the body. And a disseminated infection, it has spread and is system-wide. Acute infection may last a few hours to a few days. A chronic infection, it persists over several weeks to months. Now, hospital-acquired infections or healthcare-acquired infections are increasing difficulty. You have a lot of patients developing like C. diff in the hospital now. It's hard to kill bacteria, and it's very, it's not, when you wash your hands just with like a Germ-X or a alcohol-based hand washing agent, it doesn't kill the C. diff bacteria. You have to wash your hands with soap and water to get the bacteria off. So that's part of the reason that it spreads so quickly. And primary infection versus the secondary infection. So a primary infection was the initial cause or the initial invader, whereas a secondary infection, there was already infection there, and a second organism took advantage of the body's being busy fighting the first infection and snuck in the back door, and now you have 2 infections. I want to have you look up the differences in endemic, epidemic, and pandemic infections. Sorry, I should have taken this yellow box off. It's just asking me to make sure that I review anatomy and physiology and immunology, which I've done in the other 2 slide presentations. You have a chain of infection which makes someone sick, and if you can interrupt this chain, then you've interrupted the mode of transmission. It starts with the pathogen. The pathogen has to encounter a susceptible host. If it doesn't get anyone sick. That susceptible host has to have an appropriate reservoir, and it has to have a portal of exit. And when the bacteria or virus leaves the reservoir, which is a person, it has and is transmitted, it also has to have a portal of entry to the next person. So, for example, if you are infected with the influenza virus and your body starts replicating that influenza molecule and you become infectious. If you sneeze and cough, in the middle of a wheat field, you're not going to get anybody else sick. If you interrupt the mode of transmission when you're sneezing and coughing by covering your mouth and washing your hand, you have interrupted the mode of transmission. If you have the influenza virus and you are surrounded by people who were vaccinated successfully against the influenza virus, you will not be able to pass along the virus to anyone else. So at any point, if you can break that chain, you've broken the process of infection. The process of infection is affected. There's the host, the environment, and the actual parasite causing the infection. And we already went over immune responses to bacterial invasion. B lymphocytes are activated in bacterial invasion. T lymphocytes are activated, resulting in phagocytosis. There's a complement system activated to enhance your overall immune response. When bacteria are killed, they do release endotoxins or exotoxins, which can damage the cell of the host and initiate an inflammatory response. And just be aware that if your patient has an overwhelming infection, a bacterial infection, and especially if they're septic and you may not be aware, that first dose of antibiotics can sometimes precipitate septic shock because the bacteria all are killed. They release their toxins, and that toxin, when it's released all at once, can end up having a kind of a cascade reaction on your body. So I'm always very careful if I have a patient that I think is septic. When I give that first antibiotic, I try to go back and check on them frequently and make sure they are doing well. The consequence of uncontrolled infection, you can have anywhere from septic shock that occurs in sepsis, and then that leads to multi-system failure and even death. And I know that I've told you that I had sepsis. It was a direct result of a physician error. They didn't, after a C-section, they didn't stitch me up correctly, and my stitches came open in the waiting area after the recovery area after my surgery, and the physician decided, instead of bringing me back to the OR, to stitch me up right there in the recovery area with no sterile procedure done. And not surprisingly, I ended up getting septic. The physiologic of septic shock, you have the elderly, the very young, the chronically ill, and the immunodeficient are more susceptible. Any systemic infection, an invasive line or surgical procedure, a nosocomial infection, or trauma or burns all lends itself to septic shock. The invasive line is just a terrific portal of entry into the body. And especially if you think about where a PICC line or a central line ends up right next to your heart, and then that bacteria, when it enters, goes from your heart and is pumped all over your body. Similarly, with the surgical procedure, if it's not sterile, the same transmission can occur. In trauma and burns, you have the interruption of your natural immunity. Your skin is broken down, and that allows a nice portal of entry for bacteria. And burn patients, that's one of the big things that can kill a burn patient, is getting septic. So, I don't know that you need to kind of know all of these details, but just know that a systemic infection can cause a clotting cascade, which causes thrombi and a vascular injury and obstruction, which can cause organ dysfunction. And then there's a complement cascade occurring at the same time. It lyses the cell membrane that further injures the vascular system and obstructs it. And the activation of a large amount of macrophages releases nitric oxide. That nitric oxide increases the dilation or blood flow in your blood vessels, and you end up not having your blood vessels distribute blood where they're supposed to be distributing blood, and that causes a deficiency in the amount of oxygen in your body, and that leads to organ dysfunction. So it is a cascading reaction. The risk factors for infection, again, the very young, the very poor, the uninsured, and any residents of geographic areas where infection is prevalent, and that's typically tropical areas. How do you recognize when your patient has an infection? Okay. In sepsis, it's a serious bacterial infection that occurs in patients, and in neonatal sepsis occurs when bacteria or poisonous products like endotoxin gain access to the bloodstream, causing systemic signs and symptoms. It is really important that evaluation of the newborn occurs in the newborn nursery to rule out the presence of sepsis. There are very often nonspecific subtle signs of sepsis in neonates. For example, they might have difficulty regulating their blood sugar or difficulty regulating their temperature, poor feeding. There may be a fever, but often there's not. And those symptoms overlap and with other disorders, so you need to be careful. And especially if you do mother-baby, that you're carefully assessing your newborn and making sure that you follow up on any concerns with the physician. You need to know that any infant younger than 3 months of age, and I probably told you 2, and it depends on the textbook. What we're going to go with with this slide. Any infant younger than 3 months of age who has a temperature equal to or higher than 100.4 should be seen by a provider for evaluation for septic workup. And the septic workup would include cultures, blood tests, CBC, a C-reactive protein. A lumbar puncture might be done if the infant's not symptomatic, doesn't have a runny nose, doesn't have an ear infection, and doesn't have an obvious source of infection, and the infant looks sick. There is some evidence to suggest that infants who appear well, that just have a fever but appear well and don't have an obvious sign of infection, can just be treated with IM or IV Rocephin, which is good for 24 hours, and then follow up with the physician. Obviously, there are some risks to this. The patient could get worse, and if you have a family that doesn't follow up and they actually do have sepsis, you could end up with some liability probably. The common diagnostic tests are identical to testing for immunology or impaired immune system or inflammation, with the exception of that you add in the culture and sensitivity. And you could be culturing anything from sputum to urine to the blood to cerebrospinal fluid. depends on the symptoms of the patient. Vaccinations are key to preventing infection. Good personal hygiene, food hygiene, and patient care. It is so crucial to wash your hands with every patient interaction before you enter the room, after you touch anything in the patient's room, after you touch the patient, before you do any kind of aseptic procedure, and when you're going to leave the room. We're going to watch some videos on hand hygiene. It's one of my pet peeves. So you'll probably see me correcting you if I notice that you didn't wash your hands. And please feel free to correct me if you see that I didn't wash my hands. This is just kind of what we already discussed about interrupting the chain of infection. We're going to watch this first hand washing video. I have a virus on my computer, so I apologize.
Warning. Do not confuse any lightheartedness in the following video with a glib attitude toward the problem at hand. The makers of this video are very serious about the prevention of hospital infections. Another busy day. Traffic as usual. Now look at that. He goes right past the hand gel. Doctor!
How's the light today?
I'm a lot of pain, Doc.
Still no better.
No.
All right, let's take a look here.
Not even in gloves? Oh, come on. That doesn't really happen, does it? If you could see what I see. MRSA, VRE, Pseudomonas, etc., etc.
Here, can you take
Your attending isn't wearing gloves, so you're not either, right? Wait, the hand gel. Oh.
What? Okay, yes.
Are those gram negatives or gram positives? Oh,
How can I help you?
those microbes spread everywhere.
Yes, I am. Okay, I'll draw that blood right now.
MRSA, VRE, whatever. Good grief. Nurse, you didn't clean your hands either? Oh, man. He just had an operation, and you've put a big IV in his neck. It goes almost all the way to his heart. Please don't! Finally, that's the part I wanted to see. Clean your hands before and after every time you contact the patient or the patient's environment. If your hands are not visibly soiled and the patient doesn't have C. diff, use alcohol-based hand gel to kill those germs. See? Doesn't slow you down. Really, you should also clean your equipment just as often. Your patients thank you.
Sorry. I can get Alright. I know that was a little goofy, but it kind of did really well. Good job demonstrating. This is a second WHO video, or excuse me, CDC video on hand hygiene. And yes,
Hello.
I'm Dr. John Jernigan from the Centers for Disease Control and Prevention. Your doctor has chosen to admit you to this facility because you need high-quality medical care. The healthcare providers here want to do everything they can to help you get well and to avoid complications. You came to the hospital to get well, but you should know that each year in the United States, patients get more than 1 million infections in the hospital while they're being treated for something else. Examples of infections patients can get in the hospital include infections in their bloodstream, surgical wound, or urinary tract, as well as pneumonia. These infections can be serious and hard to treat, but there's one simple thing you and your family can do to help prevent these infections. Wash your hands and make sure that everyone who touches you, including your doctor, cleanses their hands too. Patients and their loved ones who take an active role and become involved in their treatment may have better experiences in the hospital than those who don't. In the following video, you'll see how easy it is to be involved in your care and make sure everyone around you washes their hands.
I think I'm going to skip through this one.
Hi, I'm Gail. Now that you've been admitted to the hospital, I'm here to tell you about the single most important thing you can do to help prevent infections. Everyone around you must practice proper hand hygiene.
Probably put the wrong link up, but it is still a great video. And this is just kind of a fun video from the World Health Organization. You're probably going to be laughing at me. There's some dancing involved here.
Hello everybody, my name is Professor Didier Piter from the University of Geneva Hospitals in Geneva, Switzerland. It's my pleasure to welcome you today in this important moment in infection control. As you all know, healthcare associated infections are very important and the risk of those infections is high in hospitals and during healthcare and patient care in general.
I'm going to skip ahead of the introduction to the actual video. Okay, the dancing's a little better than the rapping, but if it makes you remember to wash your hands, it's terrific.
Well, we got a big problem with these HAIs, so all you healthcare workers got to sanitize. Not talking about just going in and out, but use the who-by moments, and you have no doubt that your patients are safe, and you are too. You really can't go wrong when you follow the who. And make before you do and accept the task. And when you check the vet bell, you don't have to ask. Don't forget body fluids, that's last on the list. Now you know the who-by moments, and down goes the risk.
Before touching a patient, before an aseptic procedure, after body fluid exposure, after touching a patient, after touching patient's surroundings.
Alcohol foam products made to sanitize are eons better than those used by Semmelweis. So use that from dispenser that is up on the wall and rub a lace and twist, your hands will have a ball. And if you see a doc or nurse who won't comply, just grab him by the arm, stop him on the fly. Because it's up to each and every one of us. When we see you ain't complying, that we make a big fuss. You gotta be smart to drive higher compliance, but just keep in mind that they ain't rocket science. You need the right tools for your staff to improve, and before you know it, they'll all be in a groove. When it's all in place, you'll be feeling so wise, so your staff has got the habit to fight those HAIs.
Okay. Alright, we're moving on to another subject. This is a slide on what the Center for Disease Control considers standard precautions. First and foremost, hand hygiene. No artificial fingernails or extenders whatsoever. Wear gloves when touching. Body fluids, secretions, etc., and perform hand hygiene after. Wear personal protective equipment when you anticipate that you could come in contact with body or body fluids. I don't know if I've told all of you this story, but I took care of this little baby on pediatrics that had rotavirus, which causes like explosive diarrhea. And the mom had me look at this little girl's or this little baby's diaper area because she had a bad rash. And when I went bent down to look at the diaper area, the baby just let out a huge explosive diarrhea, and it got in my face and my eyes. So although I wouldn't necessarily tell you that you should wear a mask with a face shield when you change a diaper, I will tell you to keep in mind at all times that anything can happen in nursing care. I had a friend that was suctioning a patient, and a big chunk of mucus came out from his trach and flew, and she had her mouth open and she swallowed it. So if at all possible, use every precaution that you can when you're taking care of patients. Don't forget that it's not just you bring those germs home to your family. And we're going to just look at the other types of isolation and airborne precautions for measles, chickenpox, tuberculosis. Your patient needs a private room with a negative pressure airflow, and you're going to need to wear an N95 respirator. Droplet precautions. The patient should have a private room. A mask or respirator is required, and you may wear a gown and gloves. Contact precaution, just gloves, gown if you think you're going to come into direct contact with any kind of body fluid. For example, I always wear a gown when I'm taking care of a patient with rotavirus or C. diff that has explosive diarrhea. And in fact, I have even worn like a cover for my shoes when I took care of one patient that had such bad diarrhea. She just couldn't get to the bathroom, and after I stepped in it several times, I ended up wearing something over my shoes. In protective environment, this is when the patient has a compromised immune system, and same kind of precautions are required. Private room, positive airflow with 12 or more exchanges, which is a negative pressure airflow. I'm sorry. It's a positive airflow instead of a negative pressure airflow, and then you have to wear a mask when you're coming in and or out of the room. Mask has to be worn at all times to protect your patient from your germs. This is a video on isolation procedures and how to correctly put on a gown and gloves.
The IAPAM offers hands-on CME Botox injection training, where you'll have an opportunity.
We're going to skip the ad, so we're not going to be giving
Hi,
Botox.
my name is Pat, and today me and my teammates, Casey and Harpreet, we are going to meet later on, are going to demonstrate how to do just for isolation. We'll be demonstrating contact isolation, droplet isolation, and airborne isolation. And the aim of this short recording is just to emphasize the need for protection to avoid spreading infection. I'm going to start with showing droplet isolation. So droplet isolation is linked to diseases like influenza and mumps, where you cough or sneeze particles in the air. So what I need for droplet precaution is a gown. So I'm going to start by putting on my gown. Put my hands through and secure it in the back. Okay, then I'm going to go ahead and get my mask. And finally, I'm going to go ahead and get my gloves and make sure that I cover up my wrists. And now I'm ready to go into the room. Okay, so I step into the room and I do everything I'm supposed to be doing, and when I'm done, I'm going to walk over to the door, at least 3 feet away from the patient. And I'm going to start by taking off my gloves, pinch, pull it over, put my thumb underneath the second one, make a ball, throw it away. Then I'm going to reach for my mask, put it in the trash. Then finally, I'm going to take off my isolation gown. I'm going to pull from the neck, put my hand inside, making sure I don't touch the outside of it. Turn it into a ball,
She demonstrated it, but that's
put it in the trash, and then I'm ready to step out. Then I clean my hands. And for rooms that have the anti-room, you step out, dig down, and then step into the hallway.
Hi, I'm Casey, and I'm going to be talking to you about airborne isolation, and this would be appropriate for patients who are positive for tuberculosis, the measles, and also chickenpox. First, I'm going to be putting on my isolation gown. And then this type of isolation requires the N95 mask, which does require you to be fit tested for. And then I'm going to put on my gloves, and then enter the room. And so I'm in the patient's room. Once I've completed my patient care activities, I'm going to take off my gloves, one inside the other, throw it into the trash, take off my gown from the back, from the inside again, rolling it into a ball, throwing it into the trash, and then finally take off my mask, use some hand sanitizer, and like with droplet isolation, I can do this in the anteroom if there is an anteroom.
Hi, my name is Harpreet and I'm going to talk about contact isolation. Contact isolation is used for patients who have infectious diseases that can spread by direct contact, like MRSA, VRE, and C. diff. Okay, so these infections can spread either via direct patient-to-patient contact, or they can spread via objects that the patients use. So for this, I'm going to wear a gown and gloves. For contact isolation, you don't have to wear a face mask or a 95 face mask. Okay, so I'm dressed up in a gown, and then I'm gonna wear gloves. I'm gonna make sure that I cover my wrists as well. Okay. Then I'm going to enter the patient's room and do the procedure. And then when I'm ready to leave,
sorry, I forgot.
I'm going to roll up
I was recording.
a glove, and then I'm going to use the inner side of the other glove, make it a ball, and dispose it off. And then I'm going to take the gown, I'm going to rip it apart, and I'm going to make sure that I only use the inner surface that's clean. The outside of the gown is dirty. I'm going to make a ball, all on the inner side, and dispose it off. Wash my hands, or use the sanitizer. Okay, this is how we do contact isolation.
So these are the 3 types of isolation that you will see in the hospital. We hope that you've learned how to properly gown up and also remove this isolation gear. It is important that you enforce these rules and also encourage others to do so in order to provide proper care for your patients and also for yourself.
I thought those nursing students did a good job. All right. So, screening for infectious disease, sexually transmitted infection in high-risk groups, tuberculosis screening in high-risk groups. Tuberculosis for high risk would be anyone from coming to America from a third world country, anyone living in close quarters, healthcare workers, people with very old, very young are all at risk for tuberculosis. As far as interventions, you're going to be administering any antimicrobial therapy, providing rest and comfort measures to your patient. When you have a patient with an overwhelming infection, they're often just exhausted, and you want to encourage good nutritional support fluids. Most of the time they lose their appetite, so you may end up having to give them IV fluids. And then just be hyper vigilant of your environment. Even if you maintain excellent hand hygiene, there's a chance that you could accidentally touch something you're not aware of. So wipe off your stethoscope, wipe off the workstation, wipe off the computer that you're typing at. Do everything that you can to make sure that you're not spreading germs to another patient. I'm going to kind of allow Mrs. The pharmacology class to cover these medications, but just to know that there are classifications of antimicrobial agents, and they are used for different types of bacteria. We also have antiviral medications, antifungal medications, and antiprozoal medications. And again, I think I'm going to let that get covered in the pharmacology class. So the infection concept is just very closely tied with inflammation, as you can see, and directly linked to infection is your stress level, your natural immunity, your tissue integrity, and your nutrition. Wash your hands. And that is the end of the presentation. That was 39